Sometimes I realize there's a huge gap between therapists and patients, so specifically in terms of communication. Let me give you an example. I'm preparing a lesson, a seminar, a kind of conference aimed specifically at patients and families dealing with the aftermath of a stroke. And while preparing this lesson, I've realized that patients and therapists are like people looking out over the same river, but from two different distant banks that rarely meet. While preparing this lesson, as I usually do, I try to put myself in the shoes of those who will be listening, trying to identify their needs and desires. In this case, I imagine their primary needs are to know, with some degree of certainty, if recovery is still possible, and also to learn practical exercises they can do at home to keep practicing. This idea of recovery is exactly what I think creates the gap. And for the patient, recovery is the goal. For the therapist, it's the process. For the patient, recovery means returning to how they were before the stroke. For the therapist, it's about progressive improvement. That's the difference between the goal and the process. The patient sees it as black or white. The therapist, however, is trained to navigate all those shades of gray that recovery offers. And often the patient wants to know for sure, will I recover? Meaning, will I go back to how I was before? And if the answer is vague or unclear or uncertain, it's hard for the patient to find the willpower to commit to the rehabilitation process, which requires so much energy and so many resources. Regarding the exercises, the patient often thinks there's one specific exercise to open the hand or one to move the foot, while the therapist knows that an exercise is just one part of a program made of many interconnected exercises that evolve as the patient progresses. So, in tomorrow's lesson, I'll try to explain the mechanisms that lead to recovery, understood as progressive improvement through neuroplasticity. At the same time, I'll necessarily have to provide exercises to get patients started with a different approach to rehabilitation that they aren't used to. A type of rehabilitation that also involves cognitive processes, not just the mechanical parts of the body. Which is only right because understanding can't happen just on a theoretical level. You understand when you do. I think that I myself, the little I've learned about rehabilitation, I learned by combining theory with a lot of practice. Thinking about it now, I believe that's exactly why a book like this is the Spanish version called Interamente, was more successful than I expected because it contains so many practical examples of exercises to do at home. Actually, I expected this one to be more successful because it deals with slightly deeper themes that I think are much more important for understanding recovery. But that wasn't the case because obviously people don't want the drill, they just want the hole. Let me know what you think if there have been times with your patients or your therapist where you saw a huge gap in terms of communication.